Good morning. This is Dr. Judy Saalinger, and I'm glad that you've joined us today to hear more about substance abuse problems and what you can do to help yourself and others. Today's topic is chronic pain and opiate dependence. So whether you're listening in your car, your home, or your office, we've got some great ideas to help you today. If you or someone that you love is becoming dependent on opiate pain medication for a physically painful condition. And I'm a licensed marriage family therapist, certified addiction specialist, and clinical director of Lasting Recovery, a nationally accredited, holistic, individualized treatment program for substance use disorders, anxiety, depression, and other co-occurring issues associated with substance use. And we also offer hope and help for you that you can believe as we do, that you can find freedom from alcohol and drugs. It's time to take action. If you've said that you wanted to learn how to get off of your pain medications, and you want to begin learning a little more about the effects of chronic pain and opiate dependence on you and your life and your family, because that's what we're going to be talking about today. You know, when you look at your intention about what you really want in your life, and you've got to learn to let go of the fear and get into the solution. It might not be as bad as you think. And the first action that you can take is picking up the phone and giving us a call, reaching out, because I want you to know that you're not alone. I have been pain-free and from a chronic condition for about 30 years now, but I had it for many, many years, and was addicted to pain medication myself, and for many years, and really learned how to get off of it and how to live a life free of pain. And that actually has been why we call Lasting Recovery. I decided that I had a mission to help other people who were suffering from the conditions that are brought about by medical situations, whatever it might have been for you, might be for you. I know that what it was for me was back problems. And then I got physically addicted to opiates and benzodiazepines, and my life was a mess. So learning to get off of those is quite an extensive experience. However, there is hope, and that's what we're here today to help you with, is that you do not need to live any longer in fear, but that you want to be able to know that there is hope, there is freedom from pain medication and from other alcohol and drugs. So some people take opiate pain medications because they start using them just to see what it feels like, and then they become addicted. We see a lot of adolescents who have been raiding their parents' medicine cabinet, and they just take whatever it is that they see up there. And when they see something like OxyContin, Percocet, Percodan, Vicodin, they try it. And many of them, because their brains are forming when they're teens, they get addicted to it. And we see that as a big problem, particularly in our adolescent program and in the early adults and young adults that we see. And so when you need to recognize, or what you need to recognize, is that every day in the newspaper there's news stories about the effects of substance abuse, and more than half of all adults actually have a family history of alcoholism or drug addiction. And whether or not the family history is for pain addiction, what we know is that it's the same problem. And so people have to recognize that whether or not whether it's pain medication or alcohol just happens to be in liquid form, and the pain medication is in looks like a pill. So it's all the same stuff. It just is right there causing problems when it's overused. And today, again, we're going to be talking about chronic pain and opiate dependence and the triggers that can keep us stuck in the addiction pain cycle. I have some news here that I just read this last week, that the Army opiate treatment utilization was up 500%. And this was reported on Fox News a few weeks ago, that the U.S. Army soldiers enrolling in treatment for opiate addiction rose 500% between 2004 and 2009. So they talked about a total of 529 soldiers that sought opiate addiction treatment through the military last year, which was up from 89 people in 2004. And the enrollment jumped 500% as the Obama administration began sending more troops to Afghanistan, which is one of the world's leading opiate producers. You know, you get around it and it's like it's all over. Army officials had said that the uptick would likely represents misuse of both illicit drugs like heroin and opiate-based prescription drugs. You know, lots of injuries that people are experiencing is, they give people opiate-based prescription drugs in order to deal with that. And heroin is easily available in Afghanistan, even on the U.S. military bases, and uses of the drug is widespread among the Afghan forces, according to U.S. soldiers who served in Afghanistan. And one of the things that just came out also in the news this last week was the use of morphine initially when someone is injured can reduce the post-traumatic stress disorder. So in other words, when there's an injury or a bombing overseas and these young men are hurt, there's not only the physical trauma, but there's the emotional trauma of what's happened. And by using morphine initially on that first call to the person to help them out has been shown in some research here to be able to do something with the brain so that the memories are not fused. They're kind of diluted, shall we say, and so that the person doesn't have the extreme post-traumatic stress disorder that they would have otherwise. So we're really mixed, in our society about medications. Well, should I take an opiate pain medication? Should I not? What is the what's going to be the outcome of it? And this is not an uncommon problem. I had received a letter the other day from a gentleman who was struggling with something, and he says, dear Judy, I fell at the Safeway while carrying groceries in both arms and helping a sick child into the car. When I fell on an oil and sludge in a dark, unlighted parking lot. By falling on my left shoulder, a bone spur I didn't realize that I had from an earlier fall created tearing, and that really hurt. So the remedy for me is to have orthopedic surgery, outpatient. As he states, he's a diabetic and he has heart arrhythmia, and he's supposed to lose some weight, avoid alcohol, use a blood thinner, and he's supposed to have an EKG procedure before surgery. Now, his question is, I'm concerned that Vicodin will not be sufficient for post-surgery, but I'm concerned with reported physical and psychological drug dependency that develops for people with addictive behavior disorder like myself. And so what he also says is that he has been using alcohol for quite some time, and that he's going to stop all of this and change his complete lifestyle as a result of having to undergo this surgery. And he said, what do you think that I should do? Should I take Percodan, OxyContin? What are the medications? Well, it concerned me because if he's been having using alcohol, for example, he's has set up an addictive process. Physically, he's not in good shape. And to have the surgery and then to be put on one of these opiate pain medications can be really dangerous for him. And so my note back to him was that what he really needed to do was to be able to, if he was going to take the medication, to take it for a very short period of time. Opiate pain medication is effective generally for 3 to 5 days, and at the most up to 30 days for pain. But generally, it really isn't needed for that long period of time. What happens, though, is that people become fearful and they also become dependent on it and they think they need it. But most of the research has shown that it does no effects on pain levels beyond 30 days. Now, I have people coming in, several times throughout the month who have been on opiate pain medication for 5-10 years. They have been taking it, and it's been increasing. So they started off with Vicodin, and maybe they're taking OxyContin. I had a woman come in the other day for detox and treatment, and she had been taking Vicodin for 3 years, and she was taking 40 to 50 pills a day. Now, what's generally prescribed is 1 or 2. She obviously had an addiction going on. So she recognized that because she had 4 kids, not able to take care of them, has, in the best way that she wanted to, and was suffering from the pain and the dependence on the opiates, and ended up coming in through our detox program and is now in treatment, learning how to live life without the use of pain medication. So there's procedures that can happen that people can go through that will free them from the substances. Now, in San Diego County, what we find is that, a lot of people have been prescribed oxycodone, and the deaths from oxycodone went from to at least 54 deaths from 2008 to 2009. And so what we look at here is that, when people are taking these medications, they're not realizing that it's really a poison. It's really one of those things that that can really put us in a very dangerous situation. I know I'd seen a quote here, this Paracelsus in 1493 to 1541 AD stated that all substances are poisons. The right dose differentiates a poison and a remedy. And I think that's just so important to recognize, because we can take it for a short period of time, but at what point does it become a poison? And I know we've talked about this in previous programs where the hospitalization rate and the death rate has increased dramatically because of the overuse of substances. And in fact, since 2007, in San Diego County, only alcohol and heroin have contributed to more deaths than oxycodone for people from the ages of 16 to 25. So what we see is that people start using it, they get addicted, and then, there's a lot of dangerous side effects from it. But what we're talking about today, again, this is Dr. Judy Saalinger with Lasting Recovery, and we're talking about the chronic pain condition that goes along with the opiate dependence. And when we look at the chronic pain condition, what I'm going to say is that, oftentimes people have an injury or they have some illness that can contribute to painful situation that can go on for, up to 6 months or so. And I know that I had it for many years. I was not able to work. I was not able to walk very far. I had stayed in bed, and I was using substances. And this was before I became a therapist. I couldn't seem to get any resolution. The physicians didn't want to do anything except cut my spinal cord, and that wasn't an option for me. And so I decided that after being so sick and tired and afraid of my life, and just like, well, do I really want to go on, or do I want to do something about it? I remembered that a person had told me one time about a woman who was a Christian Scientist, and that in the Christian Science religion, people don't use pain medications and they don't go to the doctor. So I went over to her place and, knocked on her door and asked her if she would give me a sales pitch on her religion. Well, she kind of laughed, but she did give me a sales pitch on her religion. And she told me what happened. And she told me as to how we can use our thinking and our feeling and our visualization to be able to begin reducing symptoms of pain. And it was very helpful for me. I went on to, kind of gave me the foundation to begin exploring some other options. And within about 6 months' time, I had overcome an addiction that I had with the pain medication, and also had learned to use some tools that helped me to overcome my experience of pain. And that really led me to then go on and want to really help other people with this very same condition. So when we look at a chronic pain syndrome, you may be sitting there in your car and you may be having some of the symptoms. of the chronic pain condition. And what we're going to do, we're going to come back here in just a few minutes and talk about that. Again,